I would like to tell you about how long-acting injectable antiretrovirals can help improve holistic management of older patients living with HIV. So we know that people living with HIV, the population in total is aging, and we know that we have new options in the armamentarium to treat HIV that are out there. We might be a little bit shy using this in certain populations, such as the older people, but actually, so in situations such as like people with pill fatigue or polypharmacy, people suffering from stigma or having issues with privacy and confidentiality in the nursing homes or like supported accommodations, in situations where swallowing is an issue or food and timing requirements is a problem, or also when you are thinking about like different pharmacokinetics in the older person or drug-drug interactions, this can actually help. Of course, we will also save the patients from increased risk of adverse events in the elderly by, for example, sparing some nucleosides, including tenofovir and abacavir, and also we will actually have like a potential brilliant outcome of ensuring adherence in situations where neuroaging related issues such as cognitive decline or other like sensory impairment can actually make older people more difficult to actually meet the adherence that they need to control the virus.